Hi, I'm Dr. Jack West, medical oncologist at Swedish Cancer Institute in Seattle, Washington. It can be challenging to treat patients with lung cancer who also have brain metastases, and one of the particular issues we might face is that we are inclined to give a treatment to both the disease outside of the brain and at the same time give radiation to treat the disease within the brain. We tend to think that our whole body therapies like chemotherapy, typically given IV, or our oral therapies like Tarceva, also known as erlotinib, don't tend to penetrate into the brain as well, and they aren't considered to be very effective therapies for brain metastases. And so the main treatment for brain metastases is radiation. So when we give chemo and or another systemic therapy and radiation at the same time, you can get what's called a radiosensitizing effect. That is, it enhances the effect of the radiation wherever that is directed. And that can be a good thing or a bad thing, and sometimes both. In the setting of locally advanced or stage 3 lung cancer, where we are giving chest radiation and typically chemo at the same time, the combination of these two can lead to a more intense anti-cancer effect of the radiation, but at the cost of greater side effects. So you can imagine that if we're treating the brain with radiation, we might be particularly concerned that enhancing that effect could lead to harmful effects of the radiation on the brain. So it is in that context that we welcome a publication that was just released in electronic form, even before it's out in print, in the Journal of Clinical Oncology that came out of MD Anderson Cancer Center. And they reported on their experience of treating 40 patients with whole brain radiation for multiple brain metastases, and that's a very appropriate treatment approach in that setting. And these patients had also received concurrent daily Tarceva for the rest of their disease. Now, some of them had an EGFR mutation, many did not, but what they found was that there was no evidence of a detrimental effect in terms of increased side effects, either acute or long-term, from the combination of the whole brain radiation given concurrent with daily Tarceva. In fact, these patients tended to do well, had a survival that exceeded what they might have expected. But that doesn't mean that we should recommend that all patients who are getting brain radiation should also get Tarceva at the same time. But it does allow me to feel far more comfortable about having a patient receive daily radiation and also daily Tarceva without it being likely to lead to unforeseen and potentially very serious side effects. So I certainly welcome that, and I think that's going to potentially change our comfort level about this situation, which comes up not infrequently. I hope that's helpful. Take care.